White blood cells are important to understand, and we all have a rudimentary knowledge of white blood cells, but let's talk a little bit about what they are and why it's important to understand what white blood cells are and how they work in the body. First of all, the normal value for white blood cells is 4,500 to 10,000 cells per microliter. And a lot of times we're going to refer to this as just like 4.5 or 10 rather than saying the whole 1,000, okay? So white blood cells are created in the bone marrow, and their primary function is to defend the body against infection. There's a lot of different types of white blood cells, which all have different functions. For example, we have our neutrophils, we have eosinophils, basophils, we have natural killer cells, macrophages, T cells, B cells, monocytes. So their biggest role is to defend the body against infection and to remove debris. They're really classified by structure and function, okay? So phagocytes, what they do is they actually engulf and absorb bacteria, where immunocytes produce antigens and act in cell-mediated immunity. White blood cells only make up about 1% of total blood volume. So we really don't have that much in percentage, to how many red blood cells we have in blood we have a small amount of white blood cells, okay? Now, when a CBC is ordered, a CBC can be ordered with differential. What the differential means is that it measures the different types of white blood cells, okay? So we get our total white blood cell count, then we get a result for our neutrophils, our bands, eosinophils, basophils, lymphocytes, and monocytes. And by looking at these bands, we can determine what might really be going on in the patient. For example, if we have a lot of neutrophils, that might indicate there's a new infection occurring. So the provider and you as the nurse can really start to look at what's going on and what type of white blood cells the patient has and determine, what really might be going on with this patient. Another word for white blood cells is leukocytes. So that's why when we talk about leukemia, leukocytosis, and different words that have, leuk in them, that we're talking about white blood cell disorder. So things that would cause an increased level of white blood cells or a level greater than 10,000 would be infection or inflammation, trauma or stress, pregnancy, Cushing disease, asthma, allergic reactions, and things that could cause a decreased level of white blood cells are things like rheumatoid arthritis, anemia. Chemotherapy can lower it. Overwhelming infections can occur where they'll actually use up all of our white blood cells, and then we have no defense against infection. So white blood cells play a very essential role in our body, as we all know, and hopefully that helps you understand a little bit more about why and what's going on with them.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE. And check out the free resources and other goodies that we have there, just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.